that most, if not all, of the conditions that affect our stomach and generally our gastrointestinal tract can be properly managed almost to a cure it by the presence of probiotics? Well, follow me as we discuss gut diseases and probiotics. This is Daktari Explains, where we keep it as basic as possible. Now, this system, the GIT, starts all the way from the mouth, through the esophagus, the stomach, the small intestines, the large intestine, the rectum, and finally the anal canal or the anus. So stomach to the anus is our pathway by which we take food, and then we're able to gather or absorb that which the body needs and eliminate that which the body does not need. This is a pathway or a system that is loaded with microorganisms for its optimal functioning. And the reason that we're able to comfortably eat, pick out the nutrients and excrete what we don't need is actually this microbiome, among many other factors. But the microbiome, as research is proving, is one of the most essential parts of this normal functioning. Now, a side show is that microorganisms are so much in our bodies that human bites are the toughest to treat. Why is that so? It's because when someone bites you, all the organisms in their mouth, and there are many, get to infiltrate whatever that wound that they've put you, and you need a whole array of antibiotics to be able to heal that wound. That just goes to show you how much microorganisms we have. Now, diseases that affect this path have one thing in common. There is an interference in the protective barrier of this path. Given that we are dealing with very acidic environment, example in the stomach, so once the protection, a lot of mucus is produced to protect you or protect the stomach from this acidity, because the acidity is produced to deal with the food, and if there are any infections in the food, not to destroy the stomach organ itself. But what happens when the mucus that is produced to protect is not there? Now the acidity gets to directly affect the stomach lining, and that's how we get conditions like what? Gastritis, hyperacidity. If it goes to the duodenum, we get the duodenal ulcers and such like conditions. So straight to probiotics. Probiotics are a good news. Why is that so? Because probiotics are live strains, thanks to the advancing body of technology, thanks to Mother Nature, because Mother Nature gives us the same bacteria. These normal organisms we're talking about are called normal flora. So this normal flora is still present in Mother Nature. So Mother Nature had a plan B, so that once we deplete our organisms, we can get them. And our technology has availed that for us. People were able to go deep into marine life, they're able to go deep into forests and thick bushes and woods and extract these same organisms and package them in forms of powder and tablets and different formulations for us to take them live and replace. So what do these organisms do? The normal flora or the probiotics that refill our normal flora. One is normal flora allows for proper digestion of food. Now, if you're not properly digesting your food, what do? You get gas, you get bloating, and what have you. So one is proper digestion of food. Secondly, they allow for proper balancing of pH. So where acidity is supposed to be high in the stomach, that is maintained. Where a more basic environment is required, it is maintained at that, so that you don't have too much acidity going into a place that is not developed for that and burning that area. So they maintain the normal pH. So I'm discussing benefits of the normal flora and probiotics which now replace our normal flora. Number 3 is colonization. These normal organisms take residence or live in our GIT so that now infections or infectious agents cannot come and live there. Now, infections don't come nicely. They don't come knocking sweetly and saying, can I come in? No, they come with toxins. They come with enzymes to break down those mucus barrier and give you those ulcers. So what do normal flora do? They're able to produce chemicals or to basically neutralize those toxins and protect you from getting those ulcers and such like conditions. They protect you from having conditions like Crohn's disease and ulcerative colitis, or at least they stop the progression of this disease. And even cancer, because once some of these infections, especially in the GIT, they over time lead to changing of the structure, because they change the structure of the cells, and that's how you start forming the abnormal cells. Now, we might get into that a little bit later. Maybe we'll have to do a part 2 of this video. But these are the invaluable benefits of normal flora and our probiotics, which are doing the same thing. They also trigger normal cell maturation and turnover and such like, just to mention but a few of the benefits of our normal flora, the benefits of our probiotics. And that's why I say they are good news, because if you can replace your normal organism, you can deal with almost 90+% of the conditions you're going through as pertains your GIT. Now, what causes depletion of normal flora? 1, continuous use of antibiotics, which may not be avoidable in all conditions. Maybe you're getting recurrent infections for some reason, and you're always on antibiotics. When these drugs go to kill the infections, they also kill the normal organisms, and that's how we start depleting our normal flora. And now this is interesting, because sometimes it can be so bad that once you deplete your normal organisms, what have you given room to? You've given room to the infections not to come and settle. And one of the bacteria that is commonly known to take this opportunity is called Clostridium difficile, and it results in severe diarrhea and inflammation of the colon and etc. Now, of interesting is there's something called fecal transplant, where you literally take the fecal matter or the poop of someone, take the organisms from it and put in another person. Doesn't sound nice, but that just goes to show you how replacing normal organisms is vital to your health. And again, how depleting can be also be detrimental, because Clostridium difficile can actually be a life-threatening infection. We can discuss that again at a deeper level in another video. So we deplete through antibiotics, we deplete through chemotherapy. Again, chemotherapy simply involves drugs. Drugs like the 5-fluorouracil, if you check in your chemotherapy drugs, you might find it's a common and very effective agent in cancer, but it's also known to really deplete normal flora in the body. Conditions that are immunosuppressive, sorry, like the human immunodeficiency virus, that's HIV, conditions like diabetes, they really interfere with the balance of these organisms. And again, this same normal flora, when interfered with, can turn out and become infectious. So there has to be a balance. And that is what the body aims to always achieve. And that's why if you're depleting your normal flora, you're advised to add them back. So those are immunosuppressive conditions that we've mentioned. So antibiotics, chemotherapy, immunosuppressive conditions, age as well. We know everything gets depleted because the body is slowly shedding off to where it came from, as we say. So again, age is one of the ways we deplete our normal flora, and even stressive conditions. So if you're in this category, or you're a person who is liable to get a probiotic, if you have already those conditions that I've mentioned, the ulcers, gastritis, bloating, gas, you are a candidate for probiotic. As always, I'll always say, let your doctor be involved. Why? Because they're able to guide for how long you need the probiotic and at what particular point. Given, for instance, you don't want to combine an antibiotic and a probiotic. Why? Because this antibiotic will still destroy those organisms that you're taking in. So you're spending money and you're not helping yourself. So such are the guidelines that a doctor will go a long way to advise you on. Personally, I'm located at 40 Suits next to Kenyatta National Hospital. My contacts are on the screen, so you can always reach out if you need advice on this. So I hope that I've tried in a very simplified and brief way to highlight conditions in the gut and how the probiotics are able to come in. Like example, just before I finish, if you're having the inflammatory bowel disease, example ulcerative colitis, meaning you're just forming ulcers all through your digestive tract, in the intestines more especially, probiotics are very good because once you refill or you have enough probiotics, or your normal flora, more often by the time you're having ulcerative colitis, it's interfered with. By replacing, you allow for this protective barrier to be formed again and stop those formation of more and more of those ulcers. Even in Crohn's disease, it's the same. If you're having irritable bowel disease, probiotics go a long way to dealing with this condition, because now you'll be able to eat food and digest it comfortably without all the symptoms that IBS gives you. That's the inflammatory bowel syndrome. So that is all for today. I think this is such a wide topic, and I feel like I've been trying to rush and cover the most within the shortest time possible. I don't like my videos going past 15 minutes, and I can see I'm already at 12 minutes. If you have any questions, please reach out. Don't struggle with your stomach, even cancer. But importantly, let your doctor be involved, because some of these conditions are curable or at least properly handled. My name's Cynthia Jogu. I'm a medical doctor by profession. Thank you for listening to me. In this cold season, infections are bound to come. Antibiotics might be used. Protect your gut, protect your gut, protect your gut, because a healthy stomach is usually a healthy body overall. Bye bye. That's all.